Hello, we are going to show you how to properly garb and hand wash in a pharmaceutical setting. The first step in aseptic garbing is to put booty covers over your shoes. This prevents contaminants from your shoes from being brought into the clean room. Next, you cover your hair with the provided cover, making sure that all hair is secured underneath it. For women, it might be easier to secure your hair with a hair tie prior to putting on the hair cover. This is so that bacteria and germs in your hair do not put contaminants in the clean room. Then, you cover your mouth with a mask, securing it firmly behind your ears. The next step is to wash our hands. There are a couple tips to remember when washing your hands. First, you want to use warm or hot water to effectively kill as many bacteria on your hands as possible. Use soap and scrub your hands for at least 30 seconds, taking care to get in between every finger and underneath your fingernails. When you rinse, try to keep your elbows down so the water rolls off of them, taking the bacteria with it and away from your hands. Use a towel to dry your hands, starting at your fingertips and moving towards your elbow. With the same towel, turn off the water. This prevents you from getting bacteria back on your hands from when you turned on the water. After you are done, it is time to put on gloves. Make sure to grab a proper size. You want it to be tight-fitting on your hand so it doesn't slip or slide at all. Now, you will put on your gown. Make sure to button every button to ensure maximum protection and cleanliness. Lastly, you will want to use a gel sanitizer on your gloves to eliminate any lingering bacteria. If you don't have a gel sanitizer, 70% isopropyl alcohol will also work. Congratulations! You have now learned how to aseptic garb. Now, we will talk about the proper way to clean a horizontal laminar flow hood. After you have properly gowned up, you are ready to clean the laminar flow hood. First, you want to spray your gloves with 70% isopropyl alcohol. Make sure you always spray away from the hood. Then, you may grab a lint-free cloth and fold it into 4 squares. This is so that you utilize all available spaces on your cloth. Using the first side, you need to apply sterile water to wipe away the dirt. The first part of the hood you want to clean is the ceiling. You will start in one of the back corners and wipe from one side of the hood to the other. You want to slowly move forward while you do this, taking care to slightly overlap with each swipe to ensure total cleanliness. Use a different side of the cloth and apply more water. Then you will want to clean the bar of the hood. Start at one side and wipe back and forth. You can clean the hooks along the way or move them and clean them after cleaning the bar. Now you must clean the sides. Again, use a different side of the cloth and pour a small amount of water. You will use a different side of the cloth for each section of the hood, never reusing the same side. To clean the sides, start at an inside corner and wipe up and down, slowly moving forward to clean from the back of the hood to the front. Never touch the filter in the back of the hood while cleaning. Repeat the same steps to clean the other side of the hood. When you are finished with using all of your cloth, throw it away and grab a new one. To clean the bench of your laminar flow hood, you start with sterile water again. This time, you can splash a little onto your bench and wipe from the inside corner, moving side to side and slowly moving forward until you've cleaned the entire bench. Now you are ready to use the 70% isopropyl alcohol. Spray the cloth away from the hood and use the same techniques as with the sterile water. Starting with the ceiling, then the bar, and the sides. And finally, the bench. Remember that along with cleaning the hood before use, you must also have it running for at least 30 minutes to ensure the air is sterile before preparing any medications. Finally, we will talk about the proper way to prepare a sterile IV bag. As always, you are going to be in your garb. Gather all the materials you need, clean them off, and place them in the laminar flow hood. Remember to keep at least 6 inches inside the hood at all times. When you have everything on the bench, you are ready to proceed. The main thing you should always remember is never block the airflow from the back of the hood, because doing so could cause contaminants to be blown towards your equipment. Now that you are ready, you need to open an alcohol prep pad and wipe the top of every vial and insertion port of every bag. A key point to remember is to use a different pad to wipe each object. This will prevent bacteria and dirt from getting into your medication when you insert the needle. It is a good idea to put your trash in one corner of the hood so it is not getting in your way while you are preparing your med. Prepare the syringe by unwrapping and twisting the needle onto the top of your syringe. Remove the cap of the needle, still remembering to allow airflow to reach the needle and keep it clear of contaminants. Place the cap on your bench with the opening facing the airflow. Now, you can insert the needle into the vial. To prevent coring of the top of the vial, you are going to insert the needle by placing it with the bevel facing up, then quickly moving it to a 90-degree angle and pushing it through the top of the vial. For easier removal of medication, you can pull the plunger to your desired volume before inserting the needle. This allows the pressure in the vial to be equal after you remove the medicine, so you're not fighting any negative air pressure. After you have removed the volume of the medicine needed, make sure to remove any air bubbles that may be in the syringe and prep it by pushing the plunger until a drop of medicine comes out of the needle. Now, you can finally put the medicine into your IV bag. Push the needle straight into the port on the bag. You must keep the needle completely straight to prevent it from poking out the side of the port. After inserting the medication into your bag, you can either squish or shake the bag to evenly distribute the medication inside the IV solution. Now, your medication is ready to be sent up to the correct floor.